Okay, hi everyone. Appreciate you all being here for this September 2nd, I almost said August, but September 2nd briefing. I can't believe we are just about starting our 7th month into this crisis. And in a lot of ways, it seems like yesterday. In a lot of ways, it seems like a long, long time ago. So let me start off with some of the information I normally start off with on the numbers. We are at 8,311 positive as of today. That's plus 47 from Tuesday. Monday saw a plus 96, and Sunday saw a plus 33. We have one additional death to report at 132. Some people ask, well, why are the numbers kind of all over the place? And the real reason is it's the reporting mechanism when they come in and when we get those positive results. So the sum will come in batches, as you will see, depending on where they're coming from, what lab, and that's why the state looks at an average over 7 days. If you look at the numbers, the R-Naught's looking great, 0.77, well under the 1 where we want to be. The cases by group age, we continue to see that 20 to 40 age group leading the way in positive cases. And we think a lot of that is the social gatherings. Certainly the Latino Hispanic population is far exceeding everyone else on the cases by race and ethnicity. So that is something that we continue to be concerned about and continue to address. And I do want to say to health what a great job they are doing in reaching out to those folks and getting those folks who need a room, who are in need of isolation, a place where they can stay away from family members who are living more of a congregate setting with maybe multiple families. And then for those who feel that even though they're positive but asymptomatic, that they have to work to pay the rent and food, we are taking care of that in many instances, providing the rent money and food money so that they can stay at home and stay out of the job place. So congratulations to health for getting that up and running so quickly. Confirmed cases, it's good to see. This is the lowest we've seen in a long time in the hospital. Would be at 34 with 12 pending. If you look, we've got 0 from out of county, and the vast majority of ICU beds are taken by non-COVID related cases. We've got plenty of surge beds and ICU beds. The positivity rate remains good and well under what the state's requiring at 5.7. We've now exceeded 145,000 tested. And it's good to see that the average days of result is coming down also. And that was up in some cases in the past to 14 days. So it's really good to see that come down. And that's just a factor of more testing coming online and clearing that backlog that we once had by limiting the amount of tests that were in place. And that limit has been lifted, and I'll talk about that in a minute. So let me talk a little bit about, because I get a lot of questions about this. I don't know if you all are interested in it, but I'm going to go into it anyway, about the new metrics and what the state has proposed here and why we are in the most restrictive level right now. And that is because we have more than 7 cases per 100,000, though we are doing very well on the positivity test results. So, and I'm just going to walk you through because it's somewhat convoluted and people try to figure out, looking at our dashboard, how to get to the numbers. And I'm going to say don't, because there's a lot more factored in than meets the eye here. And you've got to really understand how the state is looking at it. I'm going to try to give you a short version of that. And we've got other experts on the line here who can correct me if I'm wrong. But if you take out population like ours of 767,000, you get 7 per 100,000. So that's 7.67 times 7 that were allowed per 100,000, and that equals 53. I'll round down to 53. It's actually closer to 54, but The state looks at a 7-day average, and they lag it by 7 days. So they are looking at last week's data, not current data, not the last 7 days. So it's a 7-week lag period. It's a week behind. And take into consideration that you do get a credit if you're doing more than the state average per 100,000 on the testing. So if you test more than the state average per 100,000, you do get a credit. And really the area of that credit is 0.88 credit you get if you are in between 241 to 299 tests per 100,000. Our current test ratio is right in that sweet spot at 249.4. So we do get that 0.88 credit. So you've got to factor that in when you're looking at our numbers. Where we do get, potentially penalized is because of the amount of testing we do, and that we become very flexible in testing. You can go in and test clusters as they come up, and therefore may have a more positivity rate than just or positive cases than someone else who's just doing general population. We are doing some targeted, and will continue to do targeted testing because we believe that is good for San Mateo County. We want to find out where those cases are so then we can contact trace and keep them somewhat isolated and keep them away from other folks so it doesn't continue to spread. So we are in the purple, and we know that we're going to stay here for a minimum of 3 weeks. So the short answer when people ask me is we're not getting out anytime soon of purple. We've got to be there at least 3 weeks, but then we have to get out, have 2 weeks at 7 or below on that case rate per 100,000. And that's for 2 consecutive weeks, we have to have that. So just to give you by way of example, on August 11th, the adjusted case rate, factoring in that 0.88 for us, was 9. So I believe if you did the math, that'd be somewhere in the area of 68 per 68, and we've got to get down to 7.67. Per 100,000. So the average for the 18th for the adjusted rate case was 7.6. That puts it at 57, still above that 53 or so that we have to get to. So still above for those 2 weeks, even though we're headed in the right direction. So it may be longer than 3 weeks if we can't meet that criteria, and that criteria does not change. The positivity rate we have, according to the state, is 4.8, which is great and headed in the right direction. So long story short, we're on the list for at least 3 weeks. We've got to maintain at least 2 weeks of being under 7 with that credit factor in if we keep up that testing ratio. That's per 100,000. Not an easy thing to do given the targeted testing that we're doing and the amount of testing that we are doing. So that was, hopefully that helps you a little bit on really understanding where we're at and what we got to do to get off of this list. So let's talk a little bit about Verily. I mentioned earlier, the cap is now listed. The 500 can now go to 1,000. And that is good news because we believe that will fill up relatively quickly as it was before. There's a lot of people trying to get in that weren't. But we certainly want to amplify that message again. If you have insurance and you have symptoms, go to your provider. That's why we have insurance, and that's why you have a primary care physician. And quite frankly, they may be quicker. They may be able to get you tested today as opposed to waiting for Verily to have an opening. So we would first ask people to check with their providers. The Verily lab is now open, and they are seeing now a typical turnaround of 2 to 4 days, where before it was severely impacted, and we were seeing much longer turnaround times than that. So key messages headed into Labor Day. The Pacifica beaches will be closed. Again, I want to emphasize COVID-19 does not take a holiday off. It does not take Labor Day off. And people cannot let their guard down over this weekend. And we have seen in the past spikes over the July 4th weekend and other weekends where people like to congregate, they like to get together, they like to have those barbecues, they don't wear their masks, they don't socially distance, they don't wash their hands, and we end up with more cases. We would love to get more businesses open in this county. And to do that, we're going to ask everyone to adhere to the requirements that will get us to the next level and get us more open as a society and get these businesses operating again and stop people from becoming sick and in some cases dying. So it's really becoming upon all of us to adhere to this and to really try to do our best. And I know it's difficult, but if you stay within those bubbles and you use these precautions and do not congregate, we believe it'll certainly have an impact. And we're headed in the right direction now. We don't want that to change because of a weekend of carelessness. So if you can help us amplify that message, that would be terrific. So let's see, on to just some of the other information report. We have 17 guests now that are in COVID hotels spread around the county where we have guests isolating. We have 82 guests at the Bayfront Station, and we have 101 guests in 92 different rooms at hotels spread around the county. So overall in the homeless population, we have 183 guests in rooms right now. The assistance reports, and I don't know, Ellie, can you pull that up? And we talked about the San Mateo County Immigrant Relief Fund. It's done a tremendous job and served so many people here. You can see we had a total of 20,000 pre-applications, 14,000 total invitations, and grant applications started at 9870. But total grants approved to date are just over $8,900, and that is, 8,900 applicants, which are getting $1,000, which is just tremendous when you think of the need out there. The problem is the fund has been expended up to 80% of the total fund, which is certainly not going to meet all the need out there. And we love to see more money come in to support this fund. We've had some great feedback on this, and really a lot of people who are in need of this fund. And just read you a couple of client stories here. And this one, and this is why this fund is so important. This one's from a single mother of 2 daughters who states, I've been really affected by this pandemic, not only because of the reduced income, but because of the risk of getting the virus to me and my family, which is why I lost my job and any chance to earn money to bring home. It's a really sad global situation and seems to have no end. Another client who is a recipient of this, I have lived in the U.S. for the last 20 years with my family. I collect recyclables for a living, despite the drop in metal prices, which doesn't leave much to make a living. I have looked for other types of work, but there isn't much out there. Even before the pandemic, it was hard to pay bills, including rent. I am grateful for whatever help can be provided. You can see certainly the need out there in these heart-wrenching stories of how people are just scraping by in the best of times, and now they're further impacted to a great degree because of COVID-19. On to the Census 2020, we are at 77.1%. We are still leading the state right now, but we're really going to need your help on this. We've got 28 days left before the census is complete, and the county's coordinating with CBO partners, with our CBOs, to really go into those hard-to-reach areas that are underrepresented and undercounted at this point in time, to do door-to-door canvassing and try to get people to respond to the census. And even, and this is shocking, but even a 10% rate of folks not responding to the census in this county, or I should say for every 10% that don't respond, that's $76 million a year of federal funding that would come to this county. 76 million. You spread that over 10 years, and it's an astronomical amount that could do so many things for schools and housing and all the needs that we have in this county. So it really, every person does count, and we do need to have every person counted. We don't care that we're the leader of the state. We want to get everyone counted in this county at the end of this census, and it's just getting harder and harder. In regard to community affairs outreach, the mobile mask mobile, we'll have our mobile mobile up. The one that is really decorated and stands out as a mask mobile, we'll have that up, we believe by September 10th. But today, being out there in the public, we've distributed 3,800 masks to the community. And we do this based on hotspots from community health and from the community affairs division and from cities that deploy to those areas and hand out masks in locations that are in need, amplifying that message that to stay healthy, stay safe, wear your mask, socially distance, and wash your hands. So we do have some media questions I'll go through here. First, we continue to see our local situation is stable as we monitor the many metrics we look at regularly, and the two that the state announced Friday. Is there revision to the framework?
Did you want to ask a question first, Mike?
Yeah, I'm sorry. I didn't realize that was the answer to the question. So the question is in black. So COVID data is trending well. How is the county feeling about being moved to the less restrictive red tier come Monday? We know that that's not going to happen as things are right now. We've got to be here, as I indicated, for 3 weeks. We've got to have 2 weeks of progressive improvement to get there out of the purple, and we know that that is not going to happen. And we expect new data reflecting the state's calculations by next Tuesday. So maybe that will start the 2-week process. Maybe we'll be down there. But that's why it's so important that people wear their mask and continue to socially distance and not let their guard down, because the more people we have impacted and sick, the longer we will spend in the purple. So really it is up to all of us to move on and get out of that. And it's not easy as it is now. So we're relying on people to do the right thing. Are there any updates on the contact tracing efforts? It's going well. We exceed now 115 of our employees who are dedicated to that unit. They are reaching out to individuals. I believe that they are trained and ready, and now a lot of them are handling those cases. We have addressed some of the backlog, and we'll continue to address that. Certainly, we've seen a number of more folks needing support and safety and isolation and quarantine Friday and Monday and yesterday, and I think we had 10 referrals for those services just overnight. And Sarija, I don't know if you want to add anything there.
Yeah, the only thing I would reinforce from what Mike said is that we feel like with the capacity, we're able to keep pace with the virus, but we all still have to keep focused on those core behaviors that Mike was mentioning. We're also using different methods. If we find a situation in which somebody doesn't take our call, we follow up with a text survey that folks are answering. Some, different people prefer different modes of hearing from us and learning what's necessary to keep themselves and their loved ones safe.
Great. So the next question, any numbers on how many residents have been contacted and told to quarantine? Well, every positive case is certainly followed up on, and they would be requested to stay away from other folks, whether they were having symptoms of the illness or asymptomatic. So we do want people, and hopefully people understand that they need to stay away from others, whether they're asymptomatic or showing signs. But Sarija, anything else to add?
No, we'll be revisiting the numbers we post about the contact tracing metrics. The state, in addition to the new framework, we have some requirements for a specific pool of funding that includes support for the contact tracing. So thank you for your patience with that.
Okay, good. Next question, how have fire assistance efforts at Pescara Elementary School gone so far? And I gotta say, the local assistance center just opened at 10 a.m. today. And it's really a one-stop shop for all the FEMA needs from the state and the county resources. It'll be open from 10 a.m. to 7 p.m., even on the weekend and holiday through at least next Wednesday, when we will reassess at that point in time. There will be a virtual LAC on the county's wildfire recovery webpage, anticipated to go live today, sometime later today. So I got to say that, you know, also a shout out to Puente, because they're doing such a great job out there in assisting us in that region. They're our core agency for the coast out there, and they have just been tremendous partners throughout this entire crisis. Next question, has there been substantial use of the services at this point? By 10 a.m. Today, we had 7 people waiting, and 97 people had registered online for FEMA assistance. Next question, what are the greatest needs you're seeing, and is the county accepting donations? Really, it's the DMV and FEMA requests that we get the most, and through the assistance at the LAC. So those are the two that we're seeing the most. The county is no longer accepting donations of baby or school supplies. We want to thank everybody who stepped up and gave those. That was tremendous response from the community and really helping those who were victims of this tremendous fire. And but if people do want to give, really we're asking for financial donations that can be made to Puente de la Costa, Shore, or America Red Cross. One of those two would be great. Puente is also accepting donations of bottled water and groceries at its offices in Pescara and La Honda. So they are helping with groceries, and they're accepting those donations. What assistance is being made available for undocumented residents unable to receive federal aid? All partners will be served regardless of the status, except for federal programs. So we're going to still give them everything that everyone else gets, with the exception of any federal funds that we may have. And there is federal assistance available for undocumented residents as long as one family member is a citizen, if you recall. And then Puente is also next door to the LAC and doing outreach to farm workers and really taking care of their needs specifically. So with that, Elliot, let's go ahead and open it up and see if there's any further questions.
Yeah, looks like we have one question in the chat from Ava Browns with EPA Today. Will the Great Plates Delivered Food Program for seniors be extended after September 9th of 2020?
You know, we really hope so. We don't know yet, but I got to tell you again, that is one of the most incredible things to come out of this crisis. You know, we're 2,500 of our folks in this county in need served, over $10 million put back into the community through restaurants who are employing folks who were would have been otherwise unemployed, and really filling a need that whether it's a crisis or not would probably be there. So we hope that it continues. We hope that the state and federal government sees the value in what we're doing here in feeding these folks. And again, it's just been a tremendous program to so many, and such an incredible job by our employees in the county here who have come from so many different disciplines to come together and really administer this program, which is a heavy lift, quite frankly, but something that was so needed, especially during this time of crisis.
And hand raised by Henrietta Burrows.
Henrietta, how are you?
I'm fine, thank you so much. You mentioned early on about a special fund that provides rent and food money to those who have to work. that might be COVID positive. Is this out of the Immigrant Relief Fund, or might this be a separate fund?
No, this is a separate fund that we've established through health to address this very specific need in the community. And Sarija, maybe you want to elaborate?
Yeah, hi Henrietta. We're really grateful that the Mental Health Association, which is an important nonprofit partner to health and to the county, is offering individualized case management assistance to folks who are COVID positive. They are referred from our case and contact investigations and who are facing barriers in safely isolating. And that includes access to financial relief. They are leveraging the Immigrant Relief Fund and work with Mission Assets, really streamlined application process, but also the county has invested some additional resources if that fund is not available for a specific household situation, that the financial barriers that could be preventing them from isolating could be removed. So far, they've had more than 40 referrals, estimated more than 160 individuals in the households that have been participating. So we see that need. We want to try to remove those barriers so that everybody can stay safe.
Good, thank you. Now, I also have a second question, and that is about the targeted testing. And I'm wondering how are those areas decided in terms of targeted testing? For example, East Palo Alto has more than 900 cases of those who are COVID-19 positive. Is East Palo Alto one of those targeted areas?
East Palo Alto is actually the first area we targeted in partnership with the city there. And that went well, but we really want to focus on where the need is in the community. And that's what the flexibility of this program is so great. If we could, at any time, the epidemiologists see a flare up, whether it's an apartment complex or a particular area of a community or a business or whatever, we have the ability and the flexibility to work with those cities. Or if there's certainly an area that we feel is not being represented in the testing, or doesn't have access to the testing for one reason or another, we can go in and work with the cities to test those particular areas. So it really does provide us flexibility. And you know, we still are in the congregate care residential facilities through health, you know, working with them and making sure that folks are tested. And by the way, you know, if you look at the numbers of deaths in those residential care facilities, they used to be, you know, 2/3, and they're coming down. Because I believe the great work that health has done in partnering with all of the congregate care facilities, senior care facilities in the county, and really partnering with them to make sure that there's proper PPE and separation and testing and all those things going on.
Great. Next question asks, will the Board of Supervisors be asked to consider giving more funds to the Immigrant Relief Fund in light of the new need? And secondly, will that fund be extended to assist fire victims?
Well, I mean, I think there's two different needs here, right? And we haven't fully assessed the needs of the fire victims, and we do have services out there, and I think we'll get a better idea of what the actual needs are of those, and then make some determinations around that. But it's just been too early to really understand the full needs. And what we're really looking for are gaps in those services that we provide and those needs that are already being addressed out there. So once we find those, certainly the board will have to make some decisions around that. And I don't know about, you know, we have many competing needs, as you can imagine, with all of the various requests for help out there, whether it be child care centers or rent relief or the Immigrant Relief Fund, or nonprofits who need help, or the digital divide that we're working on now. So there are so many different needs that we really have to evaluate those and see where the limited dollars we have are best leveraged to serve those who are most in need and most in need of help. So that's something we'll continue to evaluate. And really, that's a daily evaluation through this crisis. And that's nothing different than we've been doing yesterday or the day before since this crisis has started, are trying to make those evaluations on an ongoing basis. Okay, I think that is it. Thank you all so much for being here. We really appreciate you helping us get the message out there. COVID does not take the weekend off. Please stay safe and healthy, and we will see you back next week.